Happy Tuesday, everyone, or whatever day you're listening on. This is The Art of Divergence, brought to you by Neurodivergent Ohio. I'm Heather.
I am Sammy.
The information provided on our podcast is intended for informational and entertainment purposes, does not act as a substitute for the diagnosis and treatment of mental health concerns.
Thank you, Heather. And today we are continuing in our third part of talking about older adults with ADHD. We're covering treatment and management of ADHD today. So when we get past all the messy diagnosis stuff and the difficulties of that, then we get to the place where we need to learn how to treat and manage our lives with ADHD. Starting off medication. That is the first and foremost thing that we have to figure out once we get that diagnosis. And as hard as it is to figure out medication for any person with ADHD, there is a lot of difficulty with older adults. So just like there was a lack of training with and expertise in diagnosing older adults with ADHD, it extends to the unfortunate fact that providers seem to lack knowledge in treating and prescribing for the ADHD. And so in addition to this, there's also unfortunately a lack of research on the direct effects of medication in this population. So, what exactly should an older adult know about medication options if they were seeking them? The first thing to maybe use to help yourself is knowing that what works for a close blood related family member with ADHD has a really good chance of working with you. So, that's a great thing to share with your provider about what you might want to try if they were to ask. And a careful review of your daily routine should be done by a provider so that they can determine what types of medications are right for you based on how long they last and when they need to be taken. For example, we have quite a handful of different types of stimulant medication and then the other families of medication used to treat ADHD. And they all have different release patterns. They all have different strengths and dosage amounts. They have different types of pills you take or like the vehicle that it gets taken with. I remember being totally traumatized when I was a little kid because I got the capsule with the little tiny pellets in it that they thought would be the best call for me. And so that's an option. I don't suggest it, but it's right for some people. And so that can have a factor in is there, swallowing issues that someone might have that might make it difficult to take certain types of medication? Or is cutting a pill necessary? And that might be difficult with, what their motor abilities are. Is there, a time of day or a routine that they have that while maybe this is the first stimulant that comes to mind for a doctor, it doesn't really fit their pattern of daily living. Those things are all really important because if we're prescribing something that has a 10 to 12 hour life within a day versus a 6 to 8 hour life, and that's going to, not really fit that person, they really need to know that their doctor is clear on what is this medication for? What is it supposed to be helping with? And let's make sure that it's actually targeted to how we need it to work for us. That means that, you do have to have a doctor that does take interest in asking those specific questions.
The other important piece to that, too, is cardiovascular disease with stimulants. If you're having, cardiovascular issues, that's something that is a potential in your family history, something to be monitored with stimulants just because that can have a negative impact. It also could contribute to cardiovascular issues. So that's something to be mindful of. But also, it's crucial to remember to take medications consistently for optimal treatment. I know this can be hard for people in general, right? With ADHD, there's the forgetfulness. So setting reminders, making sure that medication is visible somewhere you are going to be. Invest in a pill container to help with remembering and know when it's time to seek next step if daily functions become difficult. Places like assisted livings, my grandma just moved there. She's so happy about not having to do laundry. She doesn't have to worry about when she's taking her pills if she's missed one. She's like, this is what princess treatment feels like.
Love that for her. Thank you. And I think there are a lot of points we're also going to bring up about life management outside of medication and even in management of medication a little bit later. So we'll revisit that. I also want to touch on the cardiovascular thing because that was brought up in this book that I am using as a little bit of inspo for this topic. That book is Still Distracted After All These Years by Kathleen Nadeau. And what I gathered from that was Unfortunately, like we're talking about the lack of expertise and training here, a lot of common concerns related to stimulant use can be a little overblown or stereotyped or used as kind of a easy out for not doing the work needed to prescribe for a specific set of needs. So you really do have to find someone willing to craft an approach best suited for you. For instance, many doctors might hesitate to prescribe stimulants to older adults for fear over cardiovascular risk. However, a lot of research has found that stimulant use was not associated with increased risk for harmful or lethal cardiovascular events. So, contrary to some assumptions there, the risk is really specific to the person. It's not an overall general risk. A lot of the time, if there is a provider committed to figuring out what's best for you, they won't completely write off stimulants if you have any cardiovascular concerns. They will work with a cardiovascular specialist to give you some measurements about where some of your levels are, where we might see some concern, what we might need to watch out for. And they might give you, a very specific and short term amount of stimulants with a lot of supervision. So, a lot of frequent follow up and a lot of conversation with that cardiovascular specialist. So, I mean, that's only something a doctor's going to do if they know how to and they care to really coordinate an option that's going to work for you. Unfortunately, a lot of what we're faced with in this age group is going to a doctor and saying, well, the risk is not worth the potential reward. And a lot of the times we just don't see that that's true, or we don't see them leaning on enough really hard evidence. And then we have the alternative where assumptions lead us to think that non-stimulant medication is going to have less cardiovascular risk, when studies also show that, albeit mild, they do have cardiovascular risk. The name can be a little deceiving there. So it's important for someone to really know that, like, we're not, they're a little bit of kind of misnomers times, because sometimes stimulant medications really calm an ADHD brain down if they find the right medication. Sometimes they make it easier to sleep, make it easier to not be panicked or anxious. Sometimes stimulant medications will cause issues, or non-stimulant medications will cause issues with sleep or hyperactivity or higher anxiety. So, making sure that we know that a doctor really understands the ins and outs of these things, and that as a client or as a patient, you can come to them with the specifics of what you need, like I've said before. Another unfortunate thing is there's little to no consensus on if there's any medications considered better, quote unquote, for older adults. Yet some providers can lean on that non stimulant because they have that assumption that it's safer and make that their primary recommendation. And the issue is that overall evidence shows non-stimulants are helpful to a lesser degree and to a lesser amount of people than stimulants, and are mostly a secondary option when other medications are failing to show that progress that we're looking for. So while they do work really well for some people, overall we are not seeing the level of effectiveness as high compared to stimulant medications, which is why we would not want an older adult to lose out on the possibility of having the opportunity to take that more effective overall stimulant. At the end of the day, a measure in improvement of overall quality of life is the best way to measure the efficacy of that given medication for any individual. There is also the part that hormones play here, in that sometimes hormone fluctuation can be the reason medications lose their effectiveness. As we talked about how hormones mess with our ADHD so much over our lifespan, sometimes it will be a situation where you're taking an ADHD med for quite a while, you go into menopause, and you unfortunately see a lack of effectiveness in your medication. That might, to a less informed doctor, mean, oh, you need a non-stimulant, or you need something completely different, or we need to approach this with a different set of medications, when maybe the dose needs played with, or maybe you do need just some different approaches or hormone therapy instead of specifically medication management on your ADHD. A lot of the time as well, some people that aren't as trained may just throw a higher dose at you for that, and that honestly may make things worse depending on if your body can handle it or not. So that's also not a well-trained response to something like that. Too many adults are unfortunately faced with some providers with less experience in the elderly population that tell them that risk outweighs the benefit, when in most cases it's just not tailored correctly to the individual patient if it's increasing risk for a lot of things or showing a lot of negative factors. Now, I will say that it's not impossible for these things to negatively affect an older adult. Stimulants do realistically have some risks. However, it's so much more important to see the individual effect they have on someone rather than to assume the effect they have. For any age group, we see wildly different responses to all different types of medication. And a lot of the time, even, we have a lack of training in medication. We're therapists. So even our expectation of what medication might have worked for someone might be completely different to what ends up working with them and their doctor. So I think a lot of the time we really need to make sure that we are not putting generalizations and stereotypes on these things, because if we look at the progression of the science of ADHD, that's what really got us into trouble with it. Assuming that it's a young person's disease, assuming that it's a disorder, not a disease, the assumption that it's only for boys, the assumption that you'll grow out of it. All of these things have really led to poor treatment and management. So we do need to keep that in mind as we try to effectively prescribe for people. The next important area that we want to make sure is handled when we are dealing with older adults with ADHD is therapy. So, once again, it's another area where we have less than qualified providers. It may prove difficult to find a provider that can suit your needs and give you a more specific than general approach. And putting that little extra work in to find an expert that's best for you will save you a lot of time, money, and struggle. Therapy should always start with, like we said in diagnosis, an examination of symptoms, unhelpful behaviors we want to change or improve, things that get in the way of life. As we mentioned last time, a thorough understanding of symptoms related to ADHD might not be easy for older adults. So, for therapists, knowing common issues for the population will be helpful in determining these goals. So, this book I keep referencing, it's got a great questionnaire in the back of it for personal use that can help an individual consider some problem areas in an effort to explain them better to a therapist. I really like the areas that the questionnaire hits. I would love to use it as a clinician. Some of the symptoms that it lists are absent-mindedness, forgetting things I've been told, difficulty with meal preparation, difficulty handling paperwork, difficulty putting things back where they belong, night owl tendencies, difficulty maintaining healthy weight, keeping an irregular schedule. Lots of these things are asked in a way and said in a way that I think are helpful for older adults to understand. And that's why I think phrasing is really important in making sure that you can determine problem areas and goals. If something is phrased in a way of, are you forgetful? Are you distractible? Sometimes people won't frame that in a way that is relevant to a problem that they're having. And sometimes more specific language and questions can really help to further identify that. And then as you do get those goals identified, therapy for older adults should be unique in that ideally it provides specific attention to ADHD related goals and a structure that helps ADHD brains stay on task and track with the content and progress. It's informed by the challenges and experience of later life that set everything into a specific frame, and we go forward with a really good plan and, like I said, structure to make sure it's effective and not just kind of a loose, informal talk therapy session. That's really not what's going to be super helpful right now. And so some of the specifics of that are going to be using specific therapy models.
CBT is a big one in terms of treatment for ADHD, helping things with improvement in attention. Some of those executive dysfunction skills where you have a hard time getting started on things, everything feels overwhelming. That leads into breaking things down into smaller tasks, smaller goals that feel achievable, and basically referencing that ladder technique that I used at the very beginning, right? Taking that one step at a time instead of trying to reach the overall goal and skipping steps. When you skip specific steps, that's when, we tend to slide back down that ladder and have to restart, often feeling very discouraging. Also, cognitive restructuring. That's a big component of CBT where we're reframing the way that we think about certain things. So if we're going into a task and we're having a negative idea or thought process around it, trying to reframe that into a way of, this is going to help me in a way that it's not going to be a long-term problem as long as I do it now. And then emotion dysregulation by using coping skills. That's a big one as well.
Another thing there with models is making sure that we target harmful core beliefs and unhelpful thought patterns that may have been developed by that time in life because you've lived so long with the perceptions of things being one way and you struggling with specific things and people judging you for specific things that a lot of the time those just become hard ingrained beliefs. And a lot of those approaches to therapy do deal with making sure that we're operating out of core beliefs that really are helpful and accurate, and do make sure that we have a clear, realistic view of the situation. Then, one of the most helpful parts of therapy, additionally, can be psychoeducation. Learning how the ADHD brain works and what drives you to act and think the way you do can be very enlightening and healing. And once again, can kind of reframe those negative core beliefs that you might have about why life is the way it is for you. Therapy for older adults with ADHD is especially helpful when it's strengths based. A lifetime of struggling with personal deficits and failures and judgments and heavy self esteem issues can really hinder the motivation and the desire to get better, to make progress, to see life in a different frame. And making sure that you have a therapist that can identify and highlight and validate your strengths, be a cheerleader for you in the progress that you're trying to make. Make sure that you are seeing the gratitude that you can possibly have for yourself and how you've carried yourself to the place that you're at. Those are all so important, and you really won't make a lot of progress unless you're being kind to yourself and practicing that self-acceptance and appreciation first and foremost.
Yeah, definitely celebrating those little wins. It feels achievable. It feels like a success, right? Moves into motivation for the next thing. Another therapeutic approach to consider would be ADHD therapy group for older adults with other people who are also struggling, finding that community. ADHD coaches can also be something that's beneficial. It is recommended to start off with a therapist to kind of know or put a plan in place, right? Here's some information, here's some education, here's where you start, and then more ADHD coaching for that for those who feel like they want to try it on their own and somebody to keep them accountable and kind of touch base with them. And maybe they've learned skills from their therapist and now they're like, I want to keep this going without therapy. Maybe researching getting into a ADHD coach.
ADHD coaches are really helpful for function and application, or I guess level of functioning and application of these things over a longer period, help with accountability. Some of those things that are less processing and learning based and more doing based, like making sure that the tasks that you find challenging get done, that you can use the skills you've learned, that no new things are coming up that you need to figure out how to manage. And overall, an ADHD coach can help you manage the other areas of life that you're aware of with ADHD after you've gotten a diagnosis, like medication and keeping clear systems of reminders and schedules and things like that. So hopefully that makes sense. Sometimes there's a little bit of confusion between therapists and coaches, but understanding that coaching is more, I think, application, and practicality therapy is a little more processing, learning, and figuring out those goals, identifying the strengths, things like that. Next, I'm going to go over some self management strategies that we can think about after we've cleared the bars of diagnosis, medication, and therapy. These are all coming from the book that I've been referencing, so I highly encourage that anyone interested in learning more about these go to this book and get the details on how to really make these strategies stick and some good examples for making them work for you. First off, self education about ADHD, reading videos, anything that you can use to inform yourself more about what you're going through, and then letting family in on that education as well, making sure they know what's going on with you as well. Identifying goals in your own life past therapy and past coaching so that you know what your, daily purpose and goals and vision are. I think that's important in making sure that you don't get too consumed by sometimes the frustration of ADHD and the confusion that it can cause. When you identify a problem, making sure that you have a personal problem solving strategy or routine that you can enact, like making sure that you can pay bills on time or make appointments or remember medications. Having a commitment to figuring out and implementing that problem solving strategy will be important. There's also creating structure for yourself in your life, maybe making routines or lists or plans where they didn't exist before.
Yeah, going off of list visualizations, the brain does a lot better with visual reminders. So, notebooks, sticky notes, writing on a calendar, whatever that looks like for you for help.
Absolutely. The ADHD brain really does well with visual representation of things. And then, like I mentioned before, healthy habits are huge in making sure that ADHD does not affect cognitive abilities and that we don't have any other cognitive decline. So, making sure our sleep is healthy, our diet is where we want it to be, and it's well informed for what we need, that we get regular movement. Any type of movement that raises your heart rate is going to be really good for ADHD and the way your brain is able to function for any age, but especially older adults. General stress reduction. That's also a really good one, making sure that there are no superficial stresses you're worrying about and you do target the areas of stress in your life to reduce them so they don't exacerbate your ADHD. Managing vitamin levels is also really good, making sure that we don't have deficiencies messing with our cognitive abilities. Exposure to nature, green space, sunlight, those are also really helpful to making sure your brain is where it needs to be and that, those deficiencies aren't showing up. A lot of research around the therapeutic benefits of, nature, green space, and sunlight and fresh air. And then making sure that we really put energy into positive social interactions, prioritizing outings and groups and, family dinners and community events, making sure that those things are on our list regularly so that we can stave off and combat that self isolation component and loneliness that is a big risk for older adults as well. Last couple things, making sure that your ADHD has a friendly environment to function within so that your home and your work and your spaces are friendly to your symptoms. Making sure that you are fostering meaningful social connections so that you can receive that support that you need at times where you still struggle. And especially if you're in a relationship, having couples training or guidance related to specific ADHD struggles. ADHD does affect couples a lot, and especially when you've been in a long-term relationship. I think those are some really important things to preserve the peace and positivity in that relationship, is to have a good understanding of your ADHD and how it affects you and your partner. And that sums up our series on older adults with ADHD. Hopefully, the information we've provided will provide some help and guidance for people to seek, the right kinds of diagnosis, treatment, providers, strategies, things they need if they're in this age group and they're wondering if they might have ADHD. And just as a reminder, we are part of Neurodivergent Ohio, a private practice offering assessments, counseling, and community building to ADHD and neurodivergent people of all ages. We operate out of Ohio specifically, and you can find details about our services on our website, which is linked in our description. Thank you so much for listening, and we will see you next time.